Hi, this is Dr. Robert Silich, and this is a presentation that I've put together, which is a compilation of a bunch of talks that I've given in the past. I am a plastic surgeon. I am a clinical assistant professor of plastic surgery at Cornell University Medical College in New York City. And this is a talk, as I mentioned, that I like to give to prospective patients. I found that over the years of doing this, that the more information patients have prior to seeing a plastic surgeon, or if you're at least even entertaining the thought about having something done or wondering when you should have something done, that the more information you have prior to getting to the doctor's office is the better. And then next, the idea, which I really think, kind of getting back to rock and roll, which is my generation, the analogies I'm always going to use, like the Beatles, the whole I always thought is greater than the sum of the parts. And what that means is that when all four of the guys were together, the music seemed to be spectacular. But the solo careers of each guy may be good in and of themselves, but they're never going to match something like the Beatles. And the face is basically the same way. You don't have to have the perfect nose and the perfect eyes and the perfect mouth and the perfect ears. Somehow that's not going to look right. A little bit of imperfection, which is an actual Japanese design concept called Wabi Sabi, which is very important in design and also in actual Japanese cooking, is the idea that there's something inherently beautiful in imperfection. And one of the tricks that I try and tell patients, and I try and teach residents, is that there's nothing wrong with, in fact, not only is there nothing wrong, but there's something advantageous in leaving something imperfect or leaving a apparent imperfection on someone's face, whether it's leave the wrinkles around the eyes or leave that tiny bump on the nose or the way that the lip seems to curl up. People that have extremely symmetrical faces, believe it or not, end up looking a lot more artificial, and they actually do not look as attractive as people look when they do have a little bit of imperfection to their face. So that leads to kind of the third point on this slide, which is basically the fallacy of symmetry, and that is people that are completely symmetric, and this can be done by computer graphics, you will notice will look a little strange, and they actually will look a little less human. They look much more artificial. So again, getting back to the slides that we had before about facial expressions, try and quantify them. Do you always seem to frown? Do you always seem to smile? Is there a particular expression that you make when you're excited or when you're sad? Wrinkles scientifically usually form in a right angle of where the underlying muscle is. And what that basically means is that you raise your eyebrows up and you see these horizontal lines that are above your eyebrows because the muscle underneath is a vertical muscle that's pulling your eyebrows up. And as it pulls your eyebrows up, a right angle to that pull is going to give you horizontal lines. The same way that smokers, when they pucker their lips, get the vertical lines around their mouth because the muscle that's around the mouth is actually a horizontal muscle. The other thing I think is very important is to look at photographs. Don't bring in photographs of models. Don't bring in photographs of actors and actresses. I don't get upset when that happens, but it's usually fairly unrealistic, and the only time that I think that's really helpful is if a patient is trying to convey something to me about a particular nose or about a particular set of eyes or a particular mouth that I can't really understand, and then they say, well, this so-and-so actor or actress has it. Then it becomes a little bit easier. The photographs that are more important are actually photographs of yourself. Photograph when you're younger, photograph when you're now moving into kind of your late 20s and 30s, depending on how old you are when you come to see me. And you want to look and see what stayed the same, what bothers you, and is there one thing that you really come back to. And one last point about this, one of the things that I've always noticed is that a lot of times something that people will come in and talk about is actually not something that's the result of aging, but something that's actually been there since they were younger. And the same applies to photographs of your parents, your uncles, and your siblings. A lot of people will come in and will say, my whole family has this turkey neck, or my whole family has these bags under their eyes. And this is important not only to evaluate what your family and your genetic tree looks like, but kind of really leads more philosophical into the next point, which is basically that are you prepared to change these things? the great book, Portrait of the Artist as a Young Man by James Joyce, is really a fascinating book about a young artist who struggles his entire life to basically push off his entire generation. And by the end of the book and by the end of all the struggling, what he's basically realized is that he cannot get rid of his family, and that we're all the product of all the generations that came before and the generations that came before. And I always like to use this analogy basically with your features. You could lose a little bit of your family identity by changing things too drastically. Now, I'm not really talking about gaining weight and liposuction, or if you're going to get bags under your eyes and being tired all the time, but things like a family nose, or like the Barrymore acting family. They've got the famous Barrymore chin. Those are the things that you want to really think about before you change, because you're going to not only change the way you look, but you're going to now change generations that you've had before. So where do you start? There's basically 4 different areas you want to think about. When do you want to do this? Who do you want to go to? What do you want to have done? And where are you going to have it done? So the who part of the question is fairly easy, although it can be kind of confusing. You're going to hear the words plastic surgeons, facial plastic surgeons, cosmetic surgeons. And basically, all you really need to remember is that you want to look for people that are board certified. Now, there are boards in just about anything, and there are certain boards that, believe it or not, you can probably write a check to for $50, and in a week or two they'll send you a diploma, you can frame it, and the doctor will put it in his office. So the things that you want to look for, there are 2 major boards that I think are important. One, which I think is the most important, which is the American Board of Plastic Surgery, which is the most rigorous and which is the hardest to pass, of which I'm a member. Then there's something called the American Board of Cosmetic Surgery, which again is a much less rigorous application form to apply to. However, there are fantastic, excellent surgeons that are involved in this, and I think that most people would be equally served well if they found a surgeon that is in this group as well. The main difference is that anyone can essentially be a cosmetic surgeon. There is no specific cosmetic surgery training program. There's a plastic surgery training program, there's head and neck surgery training programs, and basically anyone can decide to do plastic surgery. So the things that you always want to look for is that whatever board that your surgeon belongs to, that they're a member of the American Board of Medical Specialties, which is kind of the governing board of all of the different boards that show which board's legitimate. So where are you going to have this done? Interestingly enough, in almost all of the states in America now, there are regulations that operating rooms have to be accredited to have surgery done. You always hear a lot of anecdotal stories about horrible mishaps that happened in the offices and deaths even that happened in the office. Those basically happen out of offices that are not surgically accredited, or they happen before the age of surgical accreditation, which is very important now, and it's actually legally binding for all doctors to do it. So basically there's 3 areas where this is done: the hospital, an ambulatory surgery center, which is kind of like a mini hospital or a big office, depending on how you look at it, and then individual office operating suites. And there's 2 main organizations that do the accrediting. The first is called, for short, Quad A, because it's the American Association for Accreditation of Ambulatory Surgical Facilities. And then there's a company called the Joint Commission on Accreditation of Healthcare Organizations. And these 2 main bodies accredit outside hospital offices and surgery centers, and you should never, under any circumstances, have surgery done anywhere other than a facility that is accredited by either one of these 2 organizations. It's that important, and it can really be a life and death situation.